this health care law is taking a toll now. What's going to happen when 80 million some odd Americans actually lose their health care plans later? Jim Engel says that's not only an expectation, that's increasingly looking like reality. Hey, Jim.
Hello, Neil. Well, it's clear that a lot of people would, in fact, be confused, as you were just discussing. President Obama, of course, spent weeks trying to figure out how to apologize for the cancellation of about 5 million individual policies after promising people could keep their plans, period. He'll need a lot more apologizing, as 80 million policies from small and large employers are getting canceled along with those individual policies because they don't meet the requirements of Obamacare. Listen.
The administration estimated that approximately 78 million Americans with employer-sponsored insurance would lose their existing coverage due to the Affordable Care Act.
Now, Neil, that is already happening, but even more of the 157 million employer policies are set to be canceled next year, according to projections the administration itself made back in July of 2010. Making clear officials knew the impact of Obamacare 3 years ago. Its mid-range estimate was that by the end of 2014, 76% of small group plans would be canceled, 55% of large employer plans would be, 63% in all. Now, some official estimates were even higher than that, but why? That's because most current plans don't meet the requirements of Obamacare, which dictates each plan must cover a list of essential benefits whether people want them or not.
Things like maternity care, or acupuncture, or extensive prescription drug coverage. And so now the law is going to force them to buy other policies that, they could have gotten in the past if they wanted to, but they chose not to.
Now, some plans have already been canceled, and employers are howling about the sticker shock. David Allen, president of a company with his name in Boulder, Colorado, says his policy was discontinued, and once it was, he had to pay much higher premiums, now scheduled to increase by 52.3% in January of 2014. Other businesses with canceled policies are facing the same increases of 20, 30, 40% and more. And as you know, Neil, for most, that is way more than their profit margins, leaving them facing some very difficult decisions about health coverage. Neil?
It's all the bottom line, Jim. Thank you very much. Jim Engel.
You bet.
Well, you think getting sloshed in front of the boss is the only office party no-no? We'll see if you can pass the test next.